as far as the future of this industry, you've been in, the healthcare industry for 20 plus, almost 30 years, maybe even longer than 30 years. But when you look at traditional medication to like where we are moving forward, do you think this will gain even more and more momentum and change the entire healthcare landscape?
I do. I think it's given a lot of insight, in medicine, especially with mental health, we're only about 30% effective. If you look at placebos are kind of similar with that. So we have a lot of room for improvement. And then the neat thing about the providers like myself in anesthesia, we're about 99.8% effective. We don't mess up. We're like airline pilots. We're the safest providers out there, and we like perfectionism. So considering that you've got people like that coming to a space that's only 30% effective, we've got a bar that we're going to continually raise with this. And I do think we will shift from your serotonins and your dopamines. I think they'll shift to more of the anti-inflammatory aspects, because they are looking at cerebral inflammation.
Yes.
And if we can decrease that, and we can increase blood flow, and we can actually help with conditioning. Think about your physical, health. You have to go to the gym to work out. They're proving that the brain, you can actually condition the brain accordingly to do the same thing. So we're not reinventing the wheel. We're just going back to our roots, and we're reassessing everything, because maybe we've just been down this path for way too long, and we just need to start over. So that's kind of what we're doing. But I believe it's all going to change.
Yeah, I do think that COVID has definitely made a pause. But if you can actually look at the big picture, there's reasons why this is happening. And I think it's a good time to us kind of reevaluate what's important in life. And I think some things were just a dated model, but hopefully there continues to be that conversation and change going on. One thing I wanted to bring up too, when we focus on locations of your clinics, most of them are located in the U.S., located in population centers on the East Coast, Midwest, and the Mason-Dixie line. So as far as expansion the next couple of years, can you give us an indication of like your potential West Coast aspirations, as well as places like Europe and Canada?
Sure. Yeah. So right now, with traditional models, you want to start somewhere and then go 2 hours out, right, with your hubs.
Yep.
We've had so much heat in this space to where people are, saying, hey, if you'll come here, our university will actually partner with you. Our hospital will partner with you. So we do have a lot of these strong providers, CRNAs like myself, that are able to come out. They're able to, be completely independent providers, working with mental health providers and all this stuff, to where we're working on, like right now, with the Tennessee, Kentucky, North Carolina, Maryland, and then our first kind of biggest remote one will be Michigan. But what we're going to do with those clinics is we'll make those clinics leadership clinics,
okay,
to where they help to open additional clinics outside of them, and be more of a mentorship program, to where we can make sure that quality is maintained across the line. So we'll start there with the clinics that we have. But, if like Arizona comes to us and says, hey, we want one in Scottsdale, we'll go there, so it's trying to.
So a leadership clinic first, understand the market that you're in, walk before you run, and then expand from there.
Yep. Absolutely.
Interesting. And do you think 120 clinics, like, is the US the main priority right now as far as expansion is concerned?
US, yes, because I think that they're really big with the FDA, with the MAPS program. They put a lot of resources, financial resources in this. We do have a lot of interest actually now in the United Kingdom with London, and even Dubai. We have some interest over there as well. So been on the phone with Canada, and then also Australia with this, because Australia has a lot of they have a lot of good with ketamine. They're looking more so at the pain aspects. They're not looking at the mental health aspects as much right now. So that's the piece that we want to bring to them. And considering that we have mental health therapists and we have pain experts like myself, we can do both. So we'll be very comprehensive, and whoever wants us to go somewhere for a certain reason, that's where we go. And the biggest thing is, like, we want to go to cities where there's a veteran population, where there's universities, so we can partner with the universities. We can help them with their athletes. They can actually do their clinicals through our clinics and things like that. So we want to go to make a pillar in that community, to where people can request us to come to help their communities. And even police departments, we've actually had 7 active duty police officers that we've helped to treat, and they've actually helped them to remain on the force And what's that going to do? That's going to help with these community police officer, head on things
Right.
to where we can help address both of those as well, because we need to reestablish trust, safety, and respect for everyone in our community. And we've lost that. So
Mhm.
we've got a big agenda here, big shoes to fill, but I think we can do it.
It's amazing. This has been a great conversation. Love meeting people like you on a daily basis, and you learn so much. And I'm sure with all the people you've spoken to in all these countries across the world, I'm getting the impression that mental health is definitely a concern, regardless of what country you're speaking with, correct?
Absolutely. Yeah.
Yeah. One thing I wanted to ask too, more than just dispensing ketamine and other medications in your clinics, you've also committed to providing a telemedicine platform to support patients in their wellness goals. We're hearing more and more companies establish business models based off of this. So saying that, how much of a focus will this be in your overall strategy, and how big, I guess, can this market size get, knowing telemedicine has really come to the forefront since COVID?
Yeah, it's interesting with that because telemedicine kind of became a safety aspect with people to where they could stay in their homes and still get help. And that's a great thing. Actually, the way our company wants to unfold is we want to make our telemedicine available to those to where we can help them more so with like artificial intelligence, to where we can reach out to them if they hit certain protocols and things like that. Instead of right now in society, we expect people when they're at the lowest of the low to ask for help, and they can't always do that. So the
Hmm.
telemedicine piece that we're looking at is a nationwide hub to where we can provide support for these people that are within our programs. They may not even be applicable for ketamine or applicable for the additional services that we provide in-house, but we'll be able to extend our hand across the nation to adolescents, adults, geriatrics, to where they feel like there's somebody helping or looking out for them, because we've lost that a little bit. So that's kind of how we'll evolve our telemedicine platform there.
It's good to know. Last thing I wanted to ask, as you know, COVID, as we just said, continues to be a global concern. And based off of that, there's more and more emphasis being placed on preventative health and making sure people's immune systems are in good condition to fight against the infection. So something that is a growing trend and what more and more consumers are learning is that the proper amount of vitamin and minerals are helping to boost immune system. So saying that, are you seeing, I guess, an increase in demand for vitamin infusion treatments you offer for preventative health conditions?
Yeah. So vitamins, something we don't believe in traditional medicine at all, unfortunately. But the really, really fascinating thing about it is we're all full believers now. So like the cardiothoracic surgeon, the heart and lung surgeon that we have associated with the company, he comes in when he's starting to feel maybe a cold come on, or if his back pain actually starts acting up, he'll come in for a vitamin C infusion. So they've proven, there's scientific studies out there that have proven vitamin C helps to heal. It helps to decrease pain syndromes. The teenagers that are starting to get these pain syndromes, vitamin C is fantastic for
Hmm.
these. And then, but even, COVID especially, we don't have immune systems that are fighting this. And if anything, our immune system is getting so overwhelmed, it doesn't know what to do. So with the COVID aspects, we've seen people who have came in, not only with active symptoms, but we've also seen people who have had post-COVID brain fog or post-COVID symptoms, which unfortunately seems to be about 30% of the population. They're coming and getting vitamin infusions and they're feeling real time difference. Like while they're getting the infusion, they feel like they can take a deeper breath. They feel like their color's
Wow.
coming back. They're less nauseated. And, and that's one thing, like with vitamin C, the more the studies are with something called sepsis,
Yep.
which sepsis is, it's hard to treat. We don't know how to treat it. So instead of taking the traditional approach of throwing antibiotics and steroids at it, like we all know to do in medicine, we're actually looking at, let's support the immune system. Let's give the immune system a chance to do what she needs to do. And we're actually proving that this is a huge thing. So, with vitamin C, your B vitamins, all this, you take them orally, you only absorb 40%. You
Right.
take them IV, you absorb 100%.
Wow.
Are they water soluble? Yes, they're water soluble, meaning they get in, they get out, but they go and they start over 800 enzymatic processes in your body
Yeah.
to help your body to stay healthy for another 4 to 6 weeks. You don't have to take something every day in order to maintain the effect.
Do you think
We have to get it in there.
do you think governments, more and more governments, are starting to listen to this more and more? Because this has been a conversation that's been going on for a while, and it's a hotly contested one for sure, based on the vaccines and that. But do you think We've heard the governments talk about more and more of alternative therapeutic medicines. Do you think this starts to come to fruition in the coming months?
I hope so. I do. I mean, I know that the government, with the vitamin C, there are orders in the hospitals for vitamin C. There's orders for vitamin B12 and things like that. So hopefully they will see that. With the FDA, they really like to have, more in-house research instead of more anecdotal research. So the anecdotal is what we see in the hospital as it's occurring, case studies. The FDA really likes their controls to be very specific in a very controlled setting in order to produce the same results. So hopefully the FDA will listen to this and they will start shifting and reconsidering some things. And honestly, I'm sure that they've kind of been gut punched with all this lately too, because it's a big task on anybody. And for as much as we want to, hurt or, say negative things about the CDC and the World Health Organization, none of us in this world has seen anything like this. And for all of us to try to address it, as most effectively as we can, then we all should be patting each other on the backs.
Yeah.
Which sometimes it's harder. It's easier said than done, I feel like.
Revitalist, big expansion plans, already generating revenue, obviously in the psychedelic space, and just getting started. I really appreciate you taking the time. So if more people want to learn more information about you, where do they go to find you, Kathryn?
So they can go to revitalist.com. That's our primary site for the public company. And then anybody can email me. It's kathryn.walker@revitalistclinic.com, or they can send something to info@revitalist.com. So several ways as to be contacted.
And for investors, you trade on what exchange under what ticker symbol?
We're on the Canadian Stock Exchange, and then we're under CALM, CALM.
Awesome. This has been great. I hope this is one of many conversations, but very informative to say the least. I'm really excited about your business model because it sounds like some big plans on the near horizon, but it's great to show how this industry continues to evolve and expand, meeting people like yourself. So appreciate you taking the time to connect with us today.
Yeah. Thanks for having me.
All right. Thanks, Kathryn.
Thank you.